Welcome. This training video provides an introduction to texture-modified diets, an essential component of food service in long-term care facilities. You'll gain a foundational understanding of what these diets are and why they matter in supporting residents with chewing and swallowing difficulties. Before we begin, please note this important disclaimer. This video is for educational purposes only. It does not diagnose, treat, or manage any medical condition. Do not rely on this video for medical advice. Always consult a doctor or qualified healthcare provider for guidance regarding any health concerns or dietary needs. In this video, we'll explore 3 key topics: what a texture-modified diet is, who might need one, and why such diets are important. Understanding these basics is crucial for anyone preparing or serving meals in long-term care settings. We'll also cover when individuals need to follow a texture-modified diet, the basic preparation methods, and how to test the final product to ensure it's safe to serve. These are critical steps to maintain resident safety and support their health needs. A texture-modified diet makes chewing and swallowing easier by altering the texture of foods. These diets are based on a regular diet but involve modifying food by dicing, chopping, grinding, cutting, or pureeing. Foods that cannot be safely altered are omitted from the diet. People who may need texture-modified diets include those with poor dentition, stroke, neuromuscular diseases like Parkinson's or MS, cerebral palsy, cancers of the head or neck, those undergoing radiation, and individuals with trauma to the swallowing structures. Others include those with repeated pneumonias, advanced dementia, head or spinal injuries, and those on sedative medications or with dry mouth. Chewing and swallowing are highly complex processes. Around 50 pairs of muscles and many nerves coordinate to move food from the mouth to the stomach. When this process is impaired, texture-modified diets can help ensure safe and effective eating. Normally, food is brought to the mouth, lips remove it from the utensil, and the tongue moves it for chewing. The tongue forms a bolus and moves it to the back of the mouth. Swallowing triggers the epiglottis to close the airway and direct food down the esophagus to the stomach. When any part of the chewing or swallowing process malfunctions, the risk of aspiration or choking increases. Identifying and supporting these issues with modified textures is vital for preventing such incidents. Choking and aspiration differ. Choking blocks the airway and can be life-threatening, while aspiration occurs when food or liquid enters the airway and can lead to pneumonia. Understanding these risks underscores the importance of appropriate texture modification. Texture-modified diets play a critical role in helping individuals chew and swallow safely. They help prevent choking and reduce the risk of aspiration pneumonia. The symbol shown here is the universal choking sign. Remember, choking can be silent. It is vital to follow the texture-modified diet consistently at every meal. These diets are prescribed for safety, and there are no exceptions. Even small deviations can lead to serious health risks. Texture-modified foods are altered by cutting, chopping, mincing, or pureeing. This ensures the food is the right texture for the individual's needs and helps maintain safe and enjoyable meals. There are multiple levels of texture-modified diets, and terminology may vary between facilities. Always refer to your facility's dietary manual to ensure consistent understanding and proper implementation. For bite-sized and chopped textures, the only difference is the size of the food particles. Bite-sized pieces are no larger than 1/2 inch, and chopped pieces no larger than 1/4 inch. All food must be moist, soft, and free of hard pieces. Push with a fork to ensure the piece squashes and doesn't spring back. Minced diets have food particles around 1/8 inch in size. The food should hold its shape on a spoon, fall off easily when tilted or flicked, and not be firm or sticky. These soft, moist lumps require minimal chewing. Bite size is 1/2 inch, about the width of a fork, while chopped is 1/4 inch or half that width. Bite size may suit adults, and chopped may be better for children or developmentally disabled individuals. A trained speech-language pathologist or occupational therapist should determine the right size based on a person's needs and anatomy. Always use the fork test to check food size. This is critical because the food must be small enough to pass through the airway in case it's accidentally inhaled. Remember, Bite size equals 1/2 inch, chopped equals 1/4 inch, minced equals 1/8 inch and must pass through fork prongs. Pureed diets are for individuals with significant chewing and swallowing difficulty. The food must be smooth, lump-free, and cohesive, able to hold a shape, slide off a spoon easily, and not be sticky. No chewing is needed for pureed textures. Here you can see examples of green beans modified to different textures. This visual helps illustrate the differences between each diet level and what to aim for when preparing texture-modified vegetables. Before preparing meals, always confirm each individual's prescribed texture. Understanding the textures and following the menu and recipes ensures safety and consistency in food preparation. Different textures require specific preparation techniques. Bite-size and chopped foods are typically cut before or after cooking. Minced foods use a food processor without adding liquid. Purees also use a food processor, but with added liquid as needed. The result should be smooth, lump-free, and spoonable, not sticky or runny. Follow your recipe instructions carefully, each one may vary. Choose the correct size food processor for the amount of food being processed. For small portions, use a small processor. Avoid overfilling processors, they should be no more than half full for optimal blending. A helpful tip: use pasta that already meets the correct size requirement. This eliminates the need for extra chopping or grinding and saves valuable prep time in the kitchen. Here are examples of pasta shapes that work well for texture-modified diets. Choosing the right shape helps ensure the final product is the correct consistency and safer for the individual. Remember to test all foods, including pasta, using the fork method. This ensures the particle size is appropriate and safe for consumption. Always test the final product before serving. Check for the correct food particle size, ensure it's soft and moist, and confirm it's not sticky. This is critical for food safety. Testing before serving is essential because food texture can change after sitting. For instance, mashed potatoes may become too sticky if left too long, making them unsafe to eat. Use the fork pressure test to assess hardness. Press the side of the fork until your thumbnail blanches. If the food squashes and changes shape without bouncing back, it's soft enough to serve. Food particle size plays a major role in evaluating safety. Always use your fork to test size and texture to reduce the risk of choking or aspiration. The spoon tilt test helps evaluate food consistency. The food should hold its shape on the spoon, slide off easily when tilted, and not leave sticky residue. It should also slightly slump on a plate when served. Repeat the spoon tilt test to ensure the food isn't too sticky. Foods that are too sticky can pose a choking hazard or be difficult to swallow. Finally, remember that food should look appealing. A pleasant, inviting presentation encourages residents to eat and enjoy their meals, even with texture modifications. Thank you so much for watching. If you found this video helpful, please give it a like and subscribe to the channel for more content on nutrition, food safety, and best practices in long-term care. Don't forget to hit the notification bell so you'll know when new videos are posted. Your support helps us continue creating valuable educational content.